We're just waiting on you. Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health and the university's Chief Covet Officer. I'm going to give a brief overview of the numbers that we're seeing over the past few days for COVID in the state, and then talk about some of the topical issues that have been raised around boosters, immunizations, possibility of flu coming up in the next flu season. So I provided a handout that has some additional information I'm not going to really talk about today, but highlight principally a few points. Tennessee is currently one of the hot spots in the country with the most new cases per day on average in the United States. If you look at the national map, you can see that almost the entire state of Tennessee is really a hot zone for COVID-19 transmission right now, but other states including South Carolina, Kentucky, West Virginia, are very high rates of transmission right now. And it's been really interesting watching how the Delta variant has spread up out of Florida, Georgia, Alabama, up into Kentucky, Tennessee, West Virginia, South Carolina now. So it looks like it's starting to move into southern Illinois, southern Indiana. So I think we're still going to see a lot of U.S. cases of COVID-19 going forward. As of yesterday, according to the CDC's map, Oklahoma ranked 7th in the nation for number of new cases in the past week. So that put us in company with other states such as West Virginia, Alabama, Mississippi, Florida, and Arkansas. That data will get updated by the CDC today, so we'll see if that holds up as that many cases that are new. And I've included the CDC map that was posted to the CDC's website yesterday. So today, the case numbers were pretty low, and what we've seen now is the 7-day rolling average seems to have come down some, which is good news. The 7-day rolling average as of today was down to 2,532 cases on average daily, which is down. We peaked at around 2,800 cases. The one caveat I'm going to highlight is that weekend reporting typically has much lower rates. So testing that's done on Saturday and Sunday, and then this week on Monday, the Labor Day holiday, is reported subsequently on, Saturday's data gets reported on Monday, Sunday's on Tuesday, and Labor Day will get reported on Wednesday. So the numbers were down today, but I think we have to be cautious to make sure that the low numbers that we're seeing over the past few days don't simply reflect decreased testing, limited testing because of the weekend and holiday. So we just need to watch very carefully and see what the numbers do tomorrow. But in general, the numbers have been slowly coming down. If you look at the 7-day rolling average, it's starting to trend downward. The 3-day rolling average is definitely trending, but of course, reporting for the past 3 days has showed very, very low rates. So again, I think some hopeful news that maybe the cases are starting to go down. Certainly we're seeing that at the state level, and some of the hospitalizations are coming down also. Oklahoma County had the most cases this past week, 3,300, with Tulsa second, Cleveland County third. And that's kind of the typical pattern that we saw during the second wave of the pandemic, the big wave of the pandemic that hit in December, January, and February. That Oklahoma County usually had the most cases. Sure, just based on the population of the county, but for the first part of the Delta wave, remember, Tulsa County routinely had the most cases. They're now starting to drop off in terms of their cases. Hospitalizations are down a bit, 1,511 reported today. ICU stays have stayed pretty stable, around 420 today, people in the intensive care unit. So we certainly know that with that many people in the hospital and that many people in ICU, there will continue to be some deaths. And of course, Oklahoma largely remains in the high community transmission rate for the virus. So just a couple of news items from this week that I thought were interesting. One was an important article published in the Journal of the American Medical Association, which was a huge study looking at surveillance of the RNA vaccines. So basically, they're looking at that very, very large database that's been captured by the CDC since the start of the pandemic. So it had 11 1.8 million doses of the RNA vaccines, Pfizer and Moderna, given to 6.2 million people. So a huge study looking to see, are there big adverse events that are starting to show up that people should be concerned about with Pfizer and Moderna vaccines? And the good news is they highlighted that the mRNA vaccination was not associated with any greater risk of things like Guillain-Barré syndrome, myocarditis, and pericarditis. Remember, you can get those from any viral infection. Stroke and 20 other outcomes that they followed were no worse than they were in the general population. So again, very good evidence that the RNA vaccines are incredibly safe, and we're just not seeing any unusual outbreaks or anything of side effects from those vaccines. A very important study that they'll continue to follow, but again, more than 11 million doses of the vaccine were studied in this particular study. The second common question I'm getting right now is about booster doses. When will we get booster doses? So I've included a few things in the handout that you can take a look at. One is the current recommendations for immunocompromised people. People who are severely immunocompromised, we already recommend that they get a booster dose, a third dose of one of the RNA vaccines. So cancer patients on treatment, HIV patients, patients that have those uncommon congenital immunodeficiency states, organ transplants, bone marrow transplant patients, they definitely should all be vaccinated with a booster dose because they're high risk of infection with COVID-19 with the Delta variant. But what about everybody else? So a lot of people have heard Dr. Fauci this past week talking a lot about a study that came out of Israel that looked at whether or not a booster dose was effective. And you heard him in many interviews basically saying that it was compelling data, that there's a need for a booster dose. Because remember, in Israel, they only use the Pfizer vaccine. They have a high rate of population-based vaccination. And then they made the decision to go ahead and start giving booster doses. So they started comparing those people who got booster doses to those who did not. Important point from the study, though, that nobody seems to mention in their interviews, and that is the only people studied in Israel were people 60 years of age and older. And that makes sense because we know older people are more likely to have waning immunity. But the results were impressive. 12 days after the booster dose, they found an 11.4-fold decrease in the risk of a confirmed infection and a 10-fold decrease in the risk of severe disease. So very dramatic impact in that population of people 60 years of age and older who had previously received the Pfizer vaccine. So again, the question is, will that translate then to, let's say, a college-age person who's otherwise healthy, who's been fully vaccinated? Will they need a booster? I just don't know that we have that data yet. So we're all interested in waiting to see what the CDC and FDA recommend later this month about giving booster doses, who should get them. I put in the slide that comes out of the weekly epidemiologic report on hospitalization status for vaccinated and non-vaccinated individuals. So remember that a small number of fully vaccinated individuals do end up being hospitalized when they get reinfected with COVID-19. 73% of those people, however, are 65 years of age and older, and 90% of those are 50 years of age and older. So again, I think it supports what we saw in the Israeli study, that older people probably will benefit from a booster dose because those are the people who are fully vaccinated that are most commonly being hospitalized with what we call breakthrough infections. So again, an important study, and I think our Oklahoma data shows that. I showed the most recent hospitalization data for Oklahoma. 63% of all hospitalizations currently are in people below the age of 65. The age group that has the most admissions is 55 to 64 years of age right now in Oklahoma. And then finally, my last slide in the handout was looking at age and COVID-19. It's cumulative data from the start of the pandemic. So it includes the original Alpha variant, which didn't result in as many hospitalizations as we see with Delta, and probably less severe. If you're 85 years of age in Oklahoma and get COVID, you have about a 1 in 5 chance of death and about a 30% chance of being hospitalized. But the graphics are really clear that age is the most important predictor of both hospitalization and death from COVID-19. So as schools are open now, as we have more events, I think what we have to worry about is spreading the infection to the older population that are more likely to be hospitalized. I will note that there are deaths that are occurring in 40-year-olds in Oklahoma. And so anybody that's fully vaccinated could get reinfected, and though they usually don't end up in the hospital, it's really important that they wear a mask so they don't spread the infection to somebody else. So I'm going to stop there and take the questions.
Okay. We talked about in your remarks, you talked about hospitalizations being down slightly and the numbers overall. What does the average hospital stay look like for a COVID patient, particularly in the ICU? And is it longer than the average stay for other patients?
So the question is about length of stay for patients with COVID. So in general, the length of stay has been somewhere in the range of 6 to 7 days for most patients. And some ICU patients recover reasonably quickly and will get out of the hospital within a week or so, even in the ICU, particularly if they have relatively milder disease. Maybe they need supplemental oxygen. Maybe they're getting steroids or remdesivir, but they don't need to be placed on a ventilator. Sometimes those patients will get out of the hospital. The ones we worry about are the ones that have severe disease, that are having difficulty breathing, that have to be placed on mechanical ventilator. Those patients may be in the hospital for weeks at a time. So a proportion of patients admitted to the ICU with COVID-19 will have long lengths of stay. And that's why I think, and I've said it before, that with 420 people in the ICU, I think we're going to have quite a few patients that occupy ICU beds for some time to come, even if we start to see the cases fall off.
What are you hearing, if anything, from rural hospitals, and how are they doing?
Yeah, so I'm on a conference call with a number of rural hospitals periodically. They're really limited on bed capacity. What I really found interesting talking to some of the CEOs of the rural hospitals is that even though they may have 15 beds, 20 beds available in their hospital, they can only open 8 or 10 of them because they don't have enough nursing staff to open them. So they have limited capacity because of staffing limitations. They too are struggling with the emergency departments, and one of the most frustrating things for them is if they have a patient who's really sick that they need to transfer, it often takes them quite a few calls to get somebody transferred to another individual. One of the small hospital CEOs even told us that sometimes patients have to stay in the ambulance for a while before they can even bring them in because they just simply don't have the beds or the staff to take care of the patients. So for rural hospitals, it's been really challenging to take care of people, particularly if they had critical illness.
Over the weekend, Stillwater Medical Center made some news in the fact that they had tents outside the ER. Do you foresee that being the case here or at other hospitals in the area?
Yeah, so both Stillwater and I believe I heard that Lawton had done the same thing, had started setting up tents for overflow based on the number of expected COVID patients. Right now I think the Oklahoma City hospitals have capacity to take care of the volume of patients that we're currently seeing. But if we were to see another big surge, let's say there's a surge after Labor Day, then I think, there could be some challenges. I know all of the metro hospitals already have beds in the emergency room, what are called ER hold beds, where patients are waiting to find a bed upstairs in the hospital that's staffed that they can be moved to.
What do we know on the variants? What do we know about the Mu variant, and what can that mean for Oklahoma?
Yeah, so the question is about the Mu variant, and I meant to include a single page in the handout about Mu variant. A variant that appears to have come out of Colombia. It seems to be fairly contagious, though it's unclear whether it's as contagious as Delta. The big concern right now is that it has so many mutations about whether or not the protection you get from antibodies because you've been vaccinated will protect you against the mu variant. That we just don't know yet, whether or not those patients will have hospitalization rates that are higher or death rates. I heard a report from CDC this morning that they've identified at least one case in 49 states. I don't know about Oklahoma data. I haven't seen it in our weekly reports yet. I know that there was an outbreak in Miami where one of the major hospital systems, 9% of their infections were with the mu variant. So it's one of concern. But right now in the United States, Delta variant is still predominating infections in our state and in the U.S.
Is it possible that we'll see even further variants?
Yeah, so I think we've talked about this many times before. Any place in the world that you have unmitigated spread of COVID-19, there's the possibility of mutations. That's what viruses do. They mutate when they replicate. So the way to stop mutations is to get more people vaccinated so that the virus quits spreading. So we're seeing high rates of transmission in Oklahoma, but there are parts of the world that have single-digit vaccination rates, and there the virus spreads completely unchecked. So I think I've mentioned before, could we see the Bangladesh variant or the Vietnam variant or some other country that simply cannot vaccinate their population where the virus can spread rapidly and potentially mutate?
A little bit of shifting gears here. Excuse me. Are we expecting a worse flu season than last year?
Yeah.
And how was the flu season last year?
Yeah, so the flu season last year was incredibly impressive. I mean, we basically had very, very few cases. I think our laboratory in single digits had positive flu tests that were done on patients this past year. Flu was almost non-existent in the United States last year, and most people attribute that to the fact that we were doing the things that are known to slow the spread of respiratory viruses. Wearing masks, washing our hands, social distancing, working remotely, doing all the things that protect people from the flu. Plus, we have a flu vaccine and we used it, and a lot of people took it last year. So when you combine mitigation with vaccine, we did not see much of a flu season. That said, now we have a lot of people who haven't been exposed to the most recent variant of the influenza virus, and so will we see potentially an uptick in influenza cases? And I think one of the big concerns that most of us have is if we go back to not wearing masks and not doing good hand hygiene and social distancing, and we have a flu outbreak, then it will spread just like we saw with Delta.
If that happens, do you think our hospitals will become even more overwhelmed with COVID, flu, and the common cold type thing?
Yeah, so the question is, will the hospitals be overwhelmed? I think all of us hope that we're going to see a substantial drop in the number of COVID cases that are happening in Oklahoma as the Delta variant essentially burns itself out, both by getting more people vaccinated and by having more people that have simply been infected. The concern that many epidemiologists have is that in the wintertime, obviously, when you bring people back indoors for almost all events, will that increase the risk of transmission of COVID? Same thing could be said of influenza. So I think it's going to be another great year to wear a mask, to try to protect everybody, protect our family. And that's been the culture for many countries for many years during seasons of respiratory illness. If you're sick, if you have symptoms, stay home. Don't go to work. Don't spread the virus.
You mentioned in your remarks about testing and the delays in getting the results back and all. Is there a shortage of PCR tests, and are more going to become available?
Yeah, so the question is there a shortage of tests? I'm not aware of any shortage of reagents or testing supplies to do COVID testing. I'm not aware of any shortage of individual tests. Two things have happened. Number one, CARES Act funding paid for testing in December, January, And so lots of places were able to set up free testing sites that were readily available. Now, many insurance companies will cover the cost, but many, it's just not quite as easy. The second thing is it takes staffing to run a testing pod. You have to have a nurse or a nurse assistant or somebody that can actually get the specimen before you can do the test. And so that's been a shortage also, just having personnel and people to do it. I know the City County Health Department is trying to increase their testing capacity. I don't think it's a shortage of the test kits, the test reagents, the availability of tests, but it is a shortage of just sites to get it done, the personnel to do it, and the costs that are associated.
A follow-up on the tent question. Do you think that some hospitals like Lawton and Stillwater adding the tents will help keep people from being transferred into the metro areas?
It's a good question. I think many of the people that get that sick, that need intensive care, mechanical ventilation, ECMO, are still going to get transferred. Now Stillwater and Lawton both have those capabilities. They can take care of pretty sick patients. They don't have ECMO, so I don't know if it'll change. What they're trying to do is offload their emergency department somewhat.
With the Delta variant being so prevalent now, when do you think we could see vaccines with components of Delta in them that could make follow-up doses more effective?
That's a great question. I think Pfizer and Moderna are working on reformulated RNA vaccines that would specifically target Delta variant, but I have no idea what the timelines are.
Do we now know how going back to school may or may not have impacted our COVID numbers, or are we still waiting for more data to make a determination if going back to school had an impact on
Yeah, if you look at the graphic that I do that just shows the total number of cases in the 7-day rolling average, about a week ago we saw this tremendous spike in cases. We had plateaued, and then we saw this tremendous increase in cases. And all of us that were looking at the data felt like it probably reflected new cases that were occurring because kids were back in school. We saw all over the state kids go into quarantine, some classes went online. So we saw a lot of people getting infected with schools reopening.
We see numbers every day, case numbers, hospitalization numbers, deaths, whatever, vaccination rates. Which of those numbers most concerns you?
Well, I think the one we all should be concerned about is vaccination rates, because that's the only way we're really going to slow this so it's not going through the community anymore. It's the only way we're going to ever get this completely under control. The other number, again, testing, positivity rates, and all those things are somewhat dependent on availability of the test, people going to get it, whether people do a home test. Home tests aren't being counted at all. So I don't put too much emphasis on just testing alone or positivity rates. Hospitalization rates obviously concern me a lot because, we hit 1,600, really stretched. The Oklahoma City Metro, I think most of the hospitals here in the Metro are still stretched. But if that number were to go up more, then I think we'd have real challenges. It's very different now because we have less nursing staff and availability than we did back in December and January.
This is the last one I have. How is OU, the university, doing with its mitigation efforts? Is it the same as at other campuses, or is Norman doing better than others?
Well, I don't have any direct comparison. So the question is, the OU Norman campus doing better than other campuses around the state? I don't have any direct comparisons. I know there's certainly been students that have tested positive. We've actually seen a little bit of a reduction in the number of students now that are in quarantine. We had a little bit of a spike, not many, maybe 70 or so, but that number has actually come down. I gave a talk earlier today with Johnny Stevens from OSU, and they too had seen some cases, but I think both of us have been pleasantly surprised that we haven't seen a huge number increase of cases with the campus. One thing I told the regents today, I was very surprised by the proportion of incoming freshmen that were already vaccinated, that reported vaccination. It was much higher than we expected. And upperclassmen, the higher up you went in the university classes, more of those students were vaccinated. So there have definitely been some outbreaks. If a student tests positive in a classroom, the instructor can mandate masks for all of the students in that class. There's no perfect mitigation right now with the Delta variant. The other thing that happened in Norman that's been very helpful, we gave lots of vaccine when the students came back. We've also had the Cleveland County Health Department that brought in their portable van, and they set it up around campus to make sure that students had easy access to get vaccine. So that's been one of the real goals, to get as many people vaccinated as possible.
And I think you actually covered this, but I'm going to ask this for this reporter. Is the COVID hospitalization plateau/decline real, and will it decline or be long-lasting?
Well, I don't know yet whether it's real, and what's going to happen at the end of the week or first of next week after the Labor Day weekend. Will we see cases spike again? Opening up football stadiums for full capacity is a bit of an experiment. There is one published paper on football games that showed NCAA games and NFL games did not contribute to county levels of COVID-19, did not seem to increase cases. But the study was done at a time when most of those stadiums had limited capacity seating. So we don't know what might happen. It's an outdoor event, which gives some safety, but we don't know. So there are just lots of events, travel, football, indoor events that have occurred. There have been concerts. The big question is, will that contribute to more cases? And of course, all kids are back in school right now. So I think in a week, 10 days, we're going to have a good idea. If we see the case counts continue to decline, then I think we can feel comfortable that maybe we hit the peak of Delta. And what I would expect would be a slow but steady decline in the number of cases, which is what Missouri is seeing. They had a big peak, and then they've been slowly trailing off now for the past few weeks. Missouri's ahead of Oklahoma. Tulsa's ahead of Oklahoma City. Tulsa had cases before we did of Delta. And what I'm hoping to see over time is that we see those numbers start to trail off.
Back to the flu shot thing. When should you get your flu shot, and would it affect getting the COVID vaccine too?
Yeah, good question. So CDC changed the recommendations this past year that you can take the flu shot and the COVID vaccine at the same time. We give them in separate arms, but you can take them both at the same time as long as the patient is not currently infected with COVID-19. So we give them both. I tell people, get your flu shot as soon as it becomes available. Just don't miss the opportunity. There's no reason to delay it for that matter. And if you're due for COVID vaccine, or in a few weeks, if you happen to be eligible for a booster, you can get them both at the same time.
And do we have data on the seriousness of the disease if you get COVID and the flu at the same time?
Very, very little. So in Seattle, Washington, early in the pandemic, that first season, they did have some reports of people that were co-infected with influenza and COVID-19. And I don't know that we have any data on whether that made the patients sicker than they were if they had just one of the two. But there are some very limited reports from the first year of the pandemic suggesting that you can be infected with both.
And then a follow-up on the previous question. Have you seen the OU chapter of the American Association of University Professors Pandemic Response Progress Report?
No, I haven't seen the report. I just saw a press headline that they had put out some information, and I know that they are asking for additional restrictions, mandates, mask mandates, and again, that's a bit out of my hands. It's with the leadership of the university and the legal teams that are working with the legislature and others.
Very good. That's all we have today. Anything you want to add?
Nope.